Hi class. I want to apologize right now for any background noise that you may hear. I'm actually in the hospital. I have pneumonia. So anyway, this is my IV, and that's what you may hear going on in the background. What I'm going to talk to you about today are the 4 main vital signs that are taken when you're in the hospital. This is one of the machines that's used to do those vital signs. There's 4 main vital signs that are taken frequently when you're in the hospital, and those are body temperature, your pulse rate, your respiration rate, and your blood pressure. The first thing that they normally do is take your temperature, and a normal body temperature is normally between 97.8 degrees and 99 degrees in a healthy adult. There are 5 ways that you can take a temperature, and those 5 ways are orally, by mouth, rectally, and I think we all know what that is, axillary, which is underneath the arm, by ear. They have now thermometers that take temperature by ear, and by skin. They have special thermometers now that just touch the skin and can take temperature. It's important for your temperature to be measured because it gives the healthcare worker a good indication of where your temperature is at. And if your temperature is high, that's an indication of illness. If it's low, that's an indication of hypothermia. Either one's not good. So they need to definitely check your temperature. The next thing that they check is your pulse rate. And generally, when you get your pulse rate checked, you would take your first 2 fingers. This is what the healthcare worker does. They put it on your artery. They press firmly until they can feel your pulse. And then they count that pulse for 15 seconds and multiply whatever the result is from that by 4 to get the proper pulse rate. The importance of a pulse rate is that it tells the healthcare worker if your pulse is too slow, that's a sign of illness. If it's too fast, that's a sign of illness as well. So a good normal healthy pulse rate is between 60 to 100 for a healthy adult. There are some athletes that have pulse rates of about 40, and that's okay, but normal healthy adult is normally 60 to 100. The next thing that they check is your respiration rate, and that's an easy one for them to check. All they have to do is watch the patient breathe for about a minute. They count the breaths. Between 12 and 16 breaths is normal. If it's faster than that, that's a sign of fever. If it's too slow, that's a sign that the patient's not getting enough air, and that's obviously a problem. Of course, you want to make sure that a patient is getting the proper amount of oxygen because our bodies need oxygen. A lot of times respiration rates are also increased when a person has a nervousness or fear. If they're stressed out over being sick, that's also a good reason for their respiration rate to increase. The last thing that they normally check is blood pressure, and they generally do that using a blood pressure cuff. The blood pressure, it measures the force that the patient's blood pushes against the artery walls. And there are 2 numbers that are important when doing a blood pressure cuff. The systolic number, which is the higher number, and the diastolic number, which is the lower number. The systolic number measures the amount of pressure that's inside the artery when the heart is contracting, and the diastolic number measures the pressure outside of the artery or inside the artery when the heart is resting. A normal healthy systolic pressure should be less than 120, and a normal healthy diastolic pressure should be less than 80. Most of us have been in the hospital at some point in our life. Lucky for me, I'm here right now. And I never had really understood why the nurses have to constantly bug you about getting your vital signs. I've always felt like that was more of an irritant than anything. And now I understand that the reason that they check your vital signs is to get a good indication of where you're at, to make sure that you're not in serious, like a serious health crisis, and the easiest way for them to do it is by checking your vital signs. So the next time you're in the hospital and you have a nurse coming in constantly to check your vital signs, maybe you should be a little nicer to them. I definitely am going to be nicer to my nurses now, and understand that it's the easiest way for them to check on your health and make sure that you're where you need to be. So I hope that you learned something from this today. I know I definitely did when I was reading up on it. And make sure you know your vitals. Thanks.